All right, let's be real. Talking to your doctor about vaginal concerns can feel, well, awkward. Like, where do you even start? What do you say? Are they judging you? Spoiler, they're not. But here's the thing, your health is way too important to let a little embarrassment get in the way. So today, I'm going to show you how to have those conversations confidently, effectively, and dare I say, even a little humorously. Let's dive in. Body. 1. Start with a story. Camera pans to host leaning in conspiratorially. Host. Quick story. A couple of years ago, I had this, situation down there. Let's call it the great itch of 2019. It was like my vagina was trying to send Morse code for help me, but did I call the doctor right away? Nope. I Googled. Big mistake. Because according to the internet, I either had a yeast infection or was definitely dying. Spoiler. It was neither. Eventually, I worked up the courage to see my doctor, and guess what? They were totally chill. They'd seen it all before. And it turned out to be something super treatable. Moral of the story, just go to the doctor. Google is not your friend in these situations. 2. Why this matters. Camera shifts to a more serious tone. Host sitting upright. Host. Here's why this is important. Vaginal health is health. Period. Ignoring symptoms or feeling too embarrassed to ask questions can lead to bigger problems down the line. Plus, doctors are trained to handle these conversations. I promise you, they won't bat an eye. So, let's break it down. How do you actually bring up these topics? 3. Practical tips for the conversation. Camera switches to a checklist graphic on screen while host talks. Host. Tip number 1. Be specific. Saying something feels off is a good start, but the more details you can give, the better. For example, is it itching, burning, unusual discharge, or an odor? Give them the 411 on what's happening. Tip number 2. Write it down beforehand. If you're worried you'll freeze up, jot down your symptoms, questions, and concerns. Bonus. This makes you look super prepared. Tip number 3. Use the right language. If you're unsure about medical terms, just describe what you're experiencing in plain English. It's their job to understand. Tip number 4. Bring up sensitive topics early. If you're there for a routine checkup but have a burning question, pun intended, don't wait until they're halfway out the door to ask. 4. What to do if your doctor isn't supportive. Host. Now, what if your doctor makes you feel judged or dismisses your concerns? First of all, no. Just no. You deserve to be heard. If this happens, consider finding another doctor. Your health is too important to settle for anything less than someone who listens and cares. And hey, it's 2025. Telehealth is a thing. You've got options. 5. Normalize the conversation. Camera zooms in slightly for emphasis. Host. Remember, your doctor's office isn't a confessional. You're not there to be judged. You're there to get answers. Talking about vaginal health should be as normal as talking about a sore throat or a twisted ankle. The more we normalize these conversations, the easier it gets for everyone. Conclusion. Camera switches back to a bright, cheerful angle. Host. So there you have it. A little humor, a lot of honesty, and a whole lot of empowerment. The next time you've got a question about your vaginal health, you'll know exactly how to tackle it. And hey, let's keep this conversation going. Drop your questions or funny doctor visit stories in the comments below. Let's laugh, learn, and support each other. First things first, let's talk about why it's so important to speak up about vaginal concerns. Your doctor is there to help you maintain your health, and that includes your vaginal and reproductive health. Vaginal issues can stem from a variety of factors like hormonal changes, infections, or even stress, but the key is to talk to your doctor to get to the root of the problem. It's nothing to be embarrassed about, and your healthcare provider is trained to deal with all kinds of concerns without judgment. Cut to host talking directly to the camera. Whether it's unusual discharge, pelvic pain, or anything else that feels off, don't wait until it's too late. Early intervention can prevent bigger problems down the road. Plus, the more open you are with your doctor, the easier it is to get the right treatment. Part 2. Common vaginal concerns to discuss. Host, voiceover with bullet points appearing on screen. Now, let's break down some of the common vaginal concerns you might want to bring up with your doctor. Pain or discomfort. If you experience pelvic pain, painful intercourse, or any discomfort in the vaginal area, it's a good idea to get checked out. Abnormal discharge. Changes in color, texture, or smell can be a sign of an infection or other condition. Don't ignore it. Itching or irritation. This could be due to an infection, allergies, or even a reaction to hygiene products. It's important to find out what's going on. Bleeding between periods. Spotting or bleeding outside your normal menstrual cycle could be a sign of something that needs attention. Odor. A strong or foul odor can sometimes indicate an infection, like bacterial vaginosis or a yeast infection. Changes in menstrual cycle. Any drastic changes in your period could be worth discussing with your doctor to rule out conditions like fibroids or hormonal imbalances. Cut to host talking directly to the camera. If you're experiencing any of these, or even if you just feel like something's not quite right, it's time to make an appointment. Don't brush it off. Part 3. Preparing for the doctor's visit. Host on screen, pacing gently. So, you've decided it's time to make an appointment. That's awesome. But I get it, sometimes the thought of talking about vaginal health can feel a bit intimidating. Let's talk about how to prepare so you feel more comfortable and confident. A host sitting down, looking directly at the camera. First, jot down any symptoms you're experiencing. Be as specific as possible. The more details you provide, the easier it is for your doctor to understand what's going on. For example, when did you notice the issue? Is it constant or does it come and go? Are there any other symptoms like fever, nausea, or fatigue that accompany the problem? And if you found this video helpful, you know what to do. Hit that like button, subscribe to my channel, and share this with anyone who needs a little extra courage to make that doctor's appointment. Remember, you've got this and I've got your back. Until next time, take care of yourself and your body. Bye.